Good evening, everyone. Welcome to the Renaissance Center chat. I am Dr. Carla Debnam, your host for this evening, and I cannot wait to get this conversation started. It is something that has been on the hearts and minds of a lot of people, and it's things, again, as we try to bring up topics that we don't always share and talk about in public spaces. We might talk about them, behind closed doors. So tonight's topic is women's reproductive health, and we have our special guest, Dr. Carmen Ferrier, and she is going to give us, help us to get some clarity and gain some wisdom as regards to our health, because women's reproductive health is something we don't talk about. We may talk about other areas of health that pertain to women, but not necessarily women's reproductive health. So Dr. Carmen, if you could give us a little bit of information about your background, and then we'll go from there.
Hello, my name is Carmen Ferrier. I've been practicing obstetrics and gynecology now for about 26 years. I've been in the Baltimore area for the past 22 years, or at least it'll be 22 years coming up in August. So I practice both obstetrics and gynecology. I see girls that are young that may have cycle problems, pelvic pain issues, all the way up to women in their 90s that could potentially have some issues. So I see women throughout their life cycles, and I generally have a passion for helping women maintain their health state, reminding them about the importance of taking care of your mind and your body and your spirit.
That's awesome. So you fit right in with our dialogue for tonight, because while we're talking about women's reproductive health and the importance of that, this week happens to be Maternal Mental Health Awareness Week. So, there is something that we have to do for mental health as, women in general, whether we're mothers or sisters or aunts or grandmothers. We need to make sure we're taking care of ourselves. So one of the common questions that has arisen in our community that we, again, like I said, some things we haven't really talked about that much, is the challenge that women are having with fertility concerns. A lot of persons have delayed, starting families. And now that they're ready to, or in a position where they feel like they're ready, they're finding out that they have fertility concerns. So what are some of the most common reasons people may be facing that?
Well, first I'd like to talk about infertility and fertility and what is normal, because of us have a different perception, and a lot of women are concerned and they don't have a big cause for concern. We always hear about someone having gotten pregnant right away. They weren't really trying, but that's really not most people's stories. Only about 25% of people get pregnant when they're trying each month when they're ovulating. So there's like 75% of the people who will not get pregnant. And I often have women who show up after 3 or 4 months, like, what is wrong with me? I haven't gotten pregnant and I've been trying for 3 months. But at 6 months, only half of the women will be pregnant. At a year, 85% of the women will be pregnant. So we really only focus on that 15% if you've been trying for a year, unless you have a clear reason as to why we would think that you wouldn't be becoming pregnant. We don't do any type of evaluations. But reasons that people have infertility problems, the most common reason is something to do with your ovulation process. So you're not making eggs properly. And your first clue is that you don't get your periods every month. So if you're somebody who's skipping your cycles and you may go 2 or 3 months with no period, some women go a year, they just never get their cycle. then you're not making eggs, which means you're not going to be able to become pregnant easily. And so those would be someone who would want to go seek help early on, because it's going to take you longer in most cases.
Yeah. Now I know some people are on medications that stop the ovulation because of the severe, cramping or other side effects of the cycle. So would that contribute, those medicines, would that contribute to a person's challenge?
They can, if you're taking very high doses of ibuprofen or Aleve or Advil, that can affect your ovulation process. And there are some women who also are on medications for mental health reasons, and they affect our hormone levels, our prolactin levels, which affect our ovulatory process. So those are things that you have to be forthcoming with your provider to let them know fully what medications you're taking on. I've been surprised. I don't know why, but I've been surprised since I've gotten an electronic health record where I can see the medications that a lot of women are taking. But when I look at their intake form, they haven't written those things down. So it's very important that you let your doctors know what you're taking, because it may be affecting your health state. And if they don't know, they don't have that on their mind as being a possibility.
Yeah, that's a good point, that we need to know our own health history, including the medications. And I know sometimes we don't read, all of the side effects of the medications that we're on, or how they can kind of intermingle and, have different other side effects we hadn't anticipated. So if it's not medication, if it's not, those are the two main reasons, maybe medication and ovulation has stopped. Are there any other health challenges that might, be cause for concern if you're trying to conceive?
Yes. We start with the most common things and we start to work our way down. So we'll take about history, we'll speak to you about any particular infections you may have, what your general lifestyle is, what type of work environment you're in. So if someone's had a pelvic infection before, pelvic inflammatory disease, or even a simple STI infection, sexually transmitted infection like chlamydia or gonorrhea, there is a small chance that it can cause some scarring of your tubes. And so those women may be ovulating regularly, but their tubes are blocked. There are some women who have a condition called endometriosis. When we take their history, they may talk about having a lot of discomfort in their pelvic area, pelvic pain, even outside of their menstrual cycles. They may have discomfort when they have intercourse. And so that would make us think about endometriosis, because that can affect your ovulatory process and your eggs and the quality of your eggs. And low on my list for me, because I know a lot of women have fibroids and they automatically become concerned that their fibroids are causing them not to have a pregnancy, but it doesn't really cause infertility unless they are blocking your tubes, which is very, very uncommon. I've only had like one patient, actually. She had a huge fibroid that blocked her tubes. And when I removed the fibroid, she came back pregnant even before a post-op appointment, because she said, well, I've never gotten pregnant before, so I wasn't even thinking about it. So she's since had 3 kids. So I'm just removing that fibroid for her. But most people's cases, that's not the case. The fibroids can stay.
Okay, yeah, because I know in our community, now that you mentioned fibroids, we do have a lot of fibroids in the African American community. What is there any cause for concern because we do have a high rate of it? Or is it any reason that the medical professionals have found out why it's so prevalent in our community?
No, we don't have any research to say why it's more common in the African American community. We do know that it's hormonally based, and there are some theories out there, but there haven't been any studies that they talk about some of the chemicals that we tend to use on our hair, the processing that we've done over the years to our hair could be affecting why we have these types of changes happen to us, but no one's done a study. but there's a lot of chatter out there if you go on the internet that people will talk about reasons why they think Black women have more fibroids.
Does it have anything, I know we're speculating a little bit here, to do with our diet? Because I hear, a lot of times when you go to medical appointments, they inquire about your eating, your exercise, and lifestyle choices. So would that be, or is it hereditary?
About a third of women have fibroids, probably over half of women have fibroids. So I won't say that it's hereditary, but it definitely is common. And because we're women and we make hormones and whatever causes these fibroids to start growing, we do know that estrogen stimulates them to grow. So that's why women decide that they're not going to, that they become vegan or vegetarians and decide to stop eating meat. Because if you eat chicken or beef, those animals make hormones as well. So you're stimulating fibroids in some people's minds. But already have the fibroids and they're big, then changing your diet really is not going to do much in terms of changing the rates.
Okay, that's real helpful, because again, it's a lot of theories out there on the internet. So we just want people to, ask your doctor. That's the safest way to get some of these answers, and not explore what theories that different people we may follow have. It's better, and what's worked for them, because what's worked for them may not necessarily work for you. So it's best to always run things by your medical professional. So you would agree, right?
Definitely.
Contact your doctor.
Yes, particularly for fibroids, because they're not equal. There's some women who may have fibroids the size of a melon and it's big. And I'm like, you're not having any problems? And they're like, I'm fine. They're not bleeding, not having pain, and they don't want to do anything about it. And there's some that can have them that are small. They could be the size of a grape and sticking in the lining of the uterus, and they're having really, really heavy, dangerous bleeding that lends them into the emergency room, blood transfusions, and we can do a simple outpatient surgical procedure to remove that from the lining of their uterus and completely resolve their problem. So everybody's different. So you really need to think about you and speak to your doctor about your special case and not really compare yourself so much to other people.
Yeah, that's good. That's good. Good advice. So say if we, people have, gone through and gotten pregnant, but sometimes we know that you can not go to full term, or you might have different issues with your health regarding miscarriage, and even some people have had stillbirths. And what contributes to those, if there is, something that people need to know?
In terms of miscarriages, in the United States, we describe anyone that loses a baby prior to 20 weeks of gestation. That's considered to be a miscarriage. And most miscarriages occur within the first 3 months, within the first 12 weeks. So it's really unusual for women to have miscarriages after that point. But most of those miscarriages are related to some type of chromosomal abnormality. The chromosomes are everybody knows the X and the Y, makes you a girl, makes you a boy. But we have a lot of chromosomes that all carry all of our genes. And sometimes if we have too many of one kind, too little of one kind, your body recognizes that the baby didn't form properly, and it kind of self-corrects itself and causes the miscarriage. But about half of the miscarriages are related to chromosomal abnormalities.
Okay. And back to the fibroids, and then we'll move to stillbirth. Are fibroids cancerous, or can they become cancerous?
No.
That's a question from the audience.
No, fibroids are never cancerous. They never turn to cancer. That's why we don't have to do anything about them if you're not having any symptoms. but there's so many different treatments out there. And I know some of my colleagues in the radiology department give the GYNs a bad name, saying that we just want to do a hysterectomy, which I find to be totally untrue for me and my colleagues, because there's so many different treatment options out there, from expected management, meaning we just watch you. You can take birth control pills. You can use an IUD. There's medicines out there nowadays that are non-hormonal, specifically for fibroids to help with the heavy bleeding. We have that fibroid embolization procedure. Some women get their fibroids removed, and then there's the hysterectomy. So there's so many different options out there nowadays to treat fibroids, but no, they're not cancer, and they never turn to cancer.
Okay, so that's real helpful, since we do know a lot of people that have them, and that's a concern, especially when it comes to cancer, because we know certain things, in our bodies. We're wondering if that's the cause of when we have any, issues with cancer. And the cancers that are common to women is uterine, and what's the I can't think of the other one.
And cervical
Cervical.
cancer. We don't have a lot of cervical cancer in the United States because we screen so frequently. A lot of countries do Pap tests, but we do here in the United States. So you don't hear a lot about it. You may hear people have an abnormal Pap test, but not really a lot of treatment for cervical cancer. Ovarian cancer is rare, thankfully, because we don't have any tests to predict it. We don't have any screening tests unless somebody is in a high-risk category where they have that BRCA gene, that breast cancer gene. So they special category of screening. But for the general population, we don't have anything for ovarian cancer. And endometrial cancer, thankfully, shows itself. It's usually in older women, women on through menopause, I should say. We're not all older, but
right, but we've gone through that process. Yeah.
menopause.
Now, what about okay, what about HPV? Is that a cause for concern? I know we see a lot of commercials now for the vaccine, and they want people 45 and from teenagers to age 45 now to get the shot. What are your thoughts about that?
Yes, I definitely think that in addition to the fact that we screen for cervical cancer, that HPV is really helping decreasing the cases of cancer. It doesn't cover every single type of HPV, but it covers the high-risk type that have a higher chance of causing us to get cancer. The old vaccine used to be 4 different types of HPV. The new one covers 9 different types. And we really want to start our kids. We really don't want to wait. I know I hear some patients say that they're going to wait for their kids to decide about vaccines and things of that nature. Most of the time, by the time I see the young ladies, they've already been vaccinated because they have the most robust immune systems. We hear about them talking about the kids with their reaction to the COVID vaccines. Their immune systems are better than the older people. So one, you want to give them the vaccine when their immune system is going to be able to make the best antibodies. And 2, you want to give it to them before they even think about becoming sexually active, because they already have the antibodies before they get exposed. And again, like any vaccine, is not 100%, and it doesn't cover for every single type of HPV. They recently extended to age 45. It used to be only 26. And I don't think there's anything wrong with people getting it if they want to, but it's going to have the same benefit as it would for someone who is young with a robust immune system and has never been sexually active.
Okay, that's good, because again, we see all these commercials, we hear things, and since we were talking about cancer, I know some HPV does lead to some forms of cancer, so it's something for us to be concerned about, or at least to be aware of. Now, with stillbirth, that's different from miscarriage, and that's because you're further along in the gestational period. Is that correct?
Yes. If you're over 20 weeks in the United States, we consider that to be stillbirth. Some do 24 weeks because they look at when they feel like the baby would have been able to survive outside of the womb, which is modern medicine, somewhere between 23 and 24 weeks. Most pediatricians may be able to save the baby. Doesn't mean that it's going to be 100%, but usually those are things that they can try to save the baby. But it basically means that the baby's heartbeat stopped and the baby was born without a heartbeat.
Okay. And is there any way to know that your baby will be subjected to this? I mean, how can a person tell if they've gone to all their appointments and the baby's fine, but near the end, it doesn't work out?
That's the really hard part about it. Thankfully, this happens to like less than 1%. I think it's like 0.66%. I looked it up recently since we were going to be talking. About 0.66% of the women who are pregnant in the United States, the pregnancies in the United States end up in stillborn births. We don't know who it's going to happen to. And even when we do fetal testing of high-risk people who maybe have had a stillbirth before, or people who we know may have a higher chance, women who have a higher BMI, a higher body mass index, women who may have placental problems. That's usually what the cause of it is. People who have high blood pressure, preeclampsia, those women are at a higher risk for having stillbirths compared to other people. But still, we can't predict who it's going to happen to, even knowing that. It's more retrospective because even just about all of those women are going to have their babies be born live. So it's not like we can put them into a special group.
Right. Yeah, that helps clarify some things, because sometimes people think it's something they've done, they've along the way that caused this to happen. And like you said, a lot of times it's not anything that the mother has caused. It's something that's happened for other reasons than the mother's, not caring for herself or doing a proper prenatal care. We're back to fibroids again, because again, I know we say we know a lot of people with them. So that's a question. What's the youngest age you can develop fibroids?
I've seen patients in their late teens with fibroids, although that is extremely uncommon. So usually when my patients come in and they have abnormal bleeding and they're a teenager in their 20s, I'm not really expecting to find fibroids, but I've seen it before. It's not going to be a 0% chance of it. So usually we do an ultrasound just to be sure that there's nothing unusual going on. But most of the time, it'll be the late 20s, early 30s where they start to have significant fibroid size and changes.
Okay. Yeah. Okay, that's helpful. Again, it's good to know. So when we go into our appointments, we have better questions we can ask our doctors when we're experiencing different things. What do people need to know about reproductive health? I know a lot of times we focus on the mother. What is the role of the father in the ability to reproduce? Is it something sometimes on their end that could be the challenge?
I'm glad you asked that question, because 60% of infertility with couples is female factor and 40% is male factor. And there's some people that say it's more like 50-50. So whenever if you get to the couple who has made it a year and they're part of that 15% that didn't get pregnant, then the husband definitely, or the partner is definitely going to need to be involved in the fertility evaluation. And they're going to be looking at their semen to do a semen analysis to make sure that sperm is the proper number, the proper movement, the proper shape. They look for a lot of different things and the quality of the sperm to make sure that that's okay. And then they also look into the potential father's medical history, because that can be a problem if they have what kind of medications they're on, because that can cause them problems, and they would want to do a physical exam of their testicles because there are some conditions that can affect their sperm formation. So they would have to be a willing participant as well to be sure that they're not missing things. And unfortunately, in these couples that do all of this work, there'll be 1 out of 4 of the couples that they won't know what the problem is and why they're not able to get pregnant. Everything comes out normal for that couple.
Yeah, that because I know it's a lot of, like you said, a lot of appointments, a lot of self-disclosure about your health. And then if you're not a person that's on top of your health, or like I said, we don't read all of the side effects of the medicines we're on. So we don't always know that the medicines can affect all, these different things and have these outcomes until later on down the road. So this is good for us to all know that, hey, it's we hear it takes 2, so 2 people need to get checked out. Everybody's health is important to this process, and it's not just a one-sided issue or concern. So sometimes it is the male partner that has the health challenges that's preventing, things to happen when you're trying to have a baby. Is there family history? So I've heard that in some families, that the women have had miscarriages throughout the decades, but it's something we don't talk about. So that's why I asked you, was it kind of like a family situation where it might run in their families that they have a challenge carrying to term? So is that important?
There are not a lot of conditions that I would expect that people would have issue carrying to term. Years ago, there used to be a treatment that women used to get to help fertility, to help their fertility, that affected their daughters when they had a daughter. So then when their daughter had a pregnancy, she would have a risk for a condition called incompetent cervix. That's where your cervix doesn't stay closed and you end up with a baby early. But that's not very common. A lot of people feel like things are in their family because it's so common. About 20% of pregnancies end in miscarriage. And really even more than that go unrecognized because there's some people who really aren't that in tune with keeping track with their cycles, and they don't realize that their period wasn't late, that they actually had, a very early miscarriage. And they may say, oh, my period was really unusual, it was really heavy. And they don't really realize that it was just a very early miscarriage that they're actually having. But on average, it's about 25% of pregnancies end in miscarriage, and people just don't share it with their family members. So it's not, or their friends, it's not uncommon for people to have a few. It doesn't mean that you can't have children, because if you have one miscarriage, there's about 87% of those people will go on to have a baby right afterwards. So it's not something that's repetitive. It's not something that you have to think is wrong with your genetics or your DNA. And it's definitely not something that the couple should be thinking that they did wrong. And it's just very personal for people, and they don't always know how to express it, which is why I encourage them to grieve, because a lot of people, when they have miscarriages, particularly if they're early, they don't know they may not have told their family members. And so they don't really want to talk about it because they haven't even told them about it. And then we have the taboo just for that people don't want to tell them that they're pregnant, because just in case things don't work out. And that's when you really need your family and your friends, when you're going through this. And so people are really isolated when they suffer through this. And then they may have people who don't know how to respond with any grief process. People don't always know what to say. And so sometimes people say not the right thing, and may say, trying to console them that, well, at least you weren't farther along, or at least you didn't feel the baby moving. But most couples, once they find out they're pregnant, they have that baby graduated, they have grandkids,
Mhm.
it's already planned out in their head. So it is the time that they need to take the time for themselves to grieve the loss.
Yeah, and that's really important, and that's why, again, maternal mental health is important because during the time of carrying a child, you have different hormonal fluctuations and emotional challenges sometimes. And if you already have a mental health diagnosis, uh, depression, anxiety, bipolar, anything where you're already on medication, again, this is something you need to talk to your doctor about to make sure that if you need to continue your treatment for your mental health diagnosis while pregnant, that there are safe versions of the medicines that you need so that you won't have an episode while pregnant or a postpartum mental health crisis. And so it's important to stay on top of all of these things throughout because your health history and your mental health history is key. I had somebody tell me nobody told them that once after they had their child that they would be potentially a candidate for hospitalization because they had a mental health crisis because they were off their meds or on their own. They didn't get doctor's support for their mental health while they were expecting or postpartum. So keep that in mind. People that are listening, there might be support persons for their family members that do have certain diagnoses. They need to make sure the doctors know so that they won't fall into a crisis and have to be hospitalized postpartum. So different questions about is there any concerns to being sexually active, not sexually active as you get older? I don't think so, but you're the doctor. So should people be concerned if they're not active as an older adult?
Only if you want to be.
Right. Yeah, that's kind of personal.
Yeah, it's not going to cause any problem to you.
Mhm.
You are in menopause, your body goes through changes. So naturally, you're going to find the vaginal tissues change when our estrogen levels go down. Our vagina becomes less stretchable, and so it does shrink down over time. And if you're not using it, it's going to be more uncomfortable if you do get a partner. So I think it's important that you discuss with your gynecologist if you are thinking about resuming a relationship and you haven't been active for a while and you're in menopause, because you may need some preparatory type medications or treatments to increase the elasticity or the stretchability of your vaginal area so that you're not so uncomfortable. Because not only is discomfort a problem, but some people can literally, because the skin is so thin, your vagina can tear. And that's not common to happen. You may have like small bleeding or something like that. But I have had a patient in the emergency room that was postmenopausal, that hadn't had intercourse in a while, that had a big tear. So we can help. We have different therapies and medications that we can use to bring some of that natural stretchability, elasticity back to the vaginal area. But I mean, if you're not active and nothing's going to happen to your overall health.
Right. Yeah. It's not a health risk. It's just a health, it's probably healthy in some ways, if that's your choice. And someone asked, what's the real cause of postpartum? So, and I assume they mean postpartum depression or mental health challenges. So you want to start or I can chime in? Okay. Well, postpartum, the real cause is a lot of people have pre-existing depression, anxiety, bipolar, other mental health diagnoses that they may not have really been, diagnosed with, uh, you know, before, while they're perinatal or prenatal. So you have all of the hormones going going on together, along with stressors, because even though we're looking forward to the birth of our child, it comes with stress. It comes with a lot of stress. So some postpartum is brought on because of the intense amount of stress and lack of sleep. Remember, the child is up all hours of the night. So these things, just you're off your sleep schedule, you're stressed out, and you may not know what you're doing. So that's stressful. And if you already have a pre-existing diagnosis, that's what can cause it. Now, it doesn't mean you're going to get it. It just means it's just something to be cautious and look out for. And not everybody gets postpartum depression. So it's not, I wouldn't say a normal part of pregnancy, but if you already have things going on, you may end up with that, but not necessarily. That's why you have to take the medicine throughout the pregnancy if it's safe. And that's why you have to consult with your doctor to see if it's safe to do so. Do you have any women coming to your office that might have postpartum, and what are your suggestions, Dr. Carmen?
Unfortunately, yes, because it is not an uncommon thing, which I try my best to explain to my patients.
Mhm.
There's nothing wrong with them, that these are normal hormonal shifts that can happen.
Mhm.
And the fact that they're willing to be able to let me know can get them the help, because that's somebody who's reaching out. But a lot of women are just suffering silently because they feel like this is supposed to be a happy time. And so what are they complaining about? They have a brand new healthy baby and they don't want to express. And that makes it even worse because they're so guilty, feeling guilty about not having those happy feelings when they had this happy thing happen to them and this wonderful blessing that came into their life. But with all of the, like you said, not sleeping properly, the stress and the expectations meet the reality. The expectations of having this new family and this wonderful baby and how excited you are meet the reality of the work that has to get done. And night after night of sleeplessness, and the baby's not doing a lot right away, and just trying to, breastfeeding. Some women, I say, well, if that is stressing you out too much, you may have to stop breastfeeding and pump the milk or just give the baby the bottle, because there's so many different things that you can't do everything. They're trying to take care of the house, they're trying to take care of the cooking, take care of the baby, and there's no time left for them.
Yeah, that's so important, that you do have to reach out to your support system. And it is a lot. You have anticipated this birth, not knowing that it comes, every blessing comes with this other side. And the other side is the sleeplessness, is the other demands. People may come over unannounced, or just the expectation to socialize and do things, that you may not be up to doing, and you need your rest. So this is where boundaries help. If you set some boundaries with family and loved ones, hey, I'm only taking visitors from this time to this time, or don't call after this time. Just put some things in place so that you won't, feel like you have the pressure of, being there for everybody. And while you are happy, sometimes the depression can set in even in the happiest times of your life. And that's not something that's your fault. It's something that that happens to people, and we just need to make sure you share it, especially when you're going back for your doctor appointments. Let them know, hey, I thought I was going to be happier than this. This has been stressful. I nobody told me. They just, told me all the good things, and I'm happy, but I'm not happy. And just make sure you share it so that you can get the support and treatment that you need.
And that's where Lady Carla and her colleagues come in, because as an obstetrician, I'm kind of like the gateway keeper for that type of thing to get you to the proper resources. And so people have to keep an open mind that your mental health is a part of your health. And
Mhm.
if you are not in a proper space mentally, you're not going to be able to help anybody anyway. And so therapy, there's nothing wrong with having talk therapy. There's nothing wrong if you need to take medication for a while to get you off of the couch, to get you able to move. It doesn't make you lesser of a woman or lesser of a mother because you accepted help to be a better you. And so I can't stress enough how important it is for you to do your talk therapy. And some people, I kind of have a sense that of which of my patients are going to end up in postpartum depression.
Mhm.
They, like Lady Carla said, not be diagnosed with anxiety, but just the way they're reacting to the pregnancy in itself, I can already kind of have a sense. And I think it's important for women to even do some what I call pre-counseling, I guess, before you have the baby, to have a plan in action so
Mhm.
that you can recognize some of the symptoms when you find yourself spiraling, and that you can have somebody help work you through the plan of the anxiety attacks and the panic attacks and what you're going to do and what type of processes you're going to have to be able to work yourself through those things, and that you're kind of a little bit more prepared with um, some tools to help you handle those situations.
Yeah, I'm glad you brought up the panic attacks and things, because it's more than postpartum depression, which is what we hear a lot about. It could be postpartum anxiety, it could be the depression, it could be OCD, it could be psychosis, which is the worst form of a mental health crisis, postpartum or at any time. So those are some of the things that you do want to get prepared for, and tools, and be on the lookout for in yourself. And again, this is sometimes where family history comes in, because a lot of these mental health disorders are in the family. So if you don't know that, oh, my mother had postpartum depression or anxiety, or my grandmother had it, or my aunt or cousin, because nobody's talking about it, then when it happens to you, you feel like, wow, everybody else in the family was doing well. Why did this happen to me? But sometimes it's happened to other family members. But again, we don't share some of these things, especially when it relates to our mental health. But if you're thinking about it, ask the questions, and if they share, fine. If they don't, at least you did your part trying to find out more about yourself so you can have a healthy um, baby and a healthy pregnancy. So that's good. So what would you suggest to the families of persons that might be expecting now, or making plans and might be struggling in that area? How can we support women's reproductive health?
Just letting them know that you're there for them, supporting
Mhm.
them. Right now, things are a little bit more difficult because a lot of the practices, including my own, aren't allowing people to come into the office, but you
Mhm.
still can be there virtually. Our hospital just loosened our visitor policy at the hospital so that they can have two people there with them. But being an advocate for them, checking in with them. Did you get your test done? Did you keep your doctor's appointment? Because when people, if you know someone is a little bit depressed, they'll be more likely not to keep up with their appointments and keep their labs and things like that done, because that's like a symptom. They're not feeling up to it, to getting the things done that they need to get done. And, if you feel that you quote unquote have to overstep and call the doctor, because that's happened. And yeah, there is HIPAA and we have to be confident, keep confidentiality with our patients. But if you're providing more information to the doctor, that's not something that they're going to reject. Maybe they can't give you information about the patient, but if you're calling them, letting them know that you feel like your family member is in trouble or in danger, then they can reach out to the patient. It's not the same as us violating their confidence. But those are some things that I would think of, is just keeping a close eye on them and checking in with them.
Yeah, that's a good idea. Now, what can we do? And don't forget, everyone, you can put in questions in the chat so that we can answer them. While we are talking about this, get all your hot button questions in. What can we do to support families that are experiencing this infertility concerns, or have had I know we should support them if they've had a miscarriage or stillbirth as a loss, if they share. So how do we support persons?
That's a good question. I would think one of the things is to not make them feel that they're alone. And if you have an experience that you not find it too difficult to share, that will really help them. Support groups of people just feeling like they're not alone, because that's just half of the battle. People feel like they're on an island by themselves. Finances are a big problem in terms of infertility evaluations and treatments. So if you know that they're in that particular area where they are spending a lot of money, and there's something nice that you could do for them to brighten their day, I'm sure that would definitely be something that would be welcomed. But those are the things that I think of off of the top of my head, is to share your experiences if you've gone through that, so that they know they are not in themselves. Because I can tell you, years later, there are women who have suffered miscarriages. I remember years ago, one of my friends went through a miscarriage, and I had to be her doctor because I happened to be on call that night, and she came to the hospital. And she's since had two kids. They're both in college now. And she just recently talked to me about that again, and she got teary and she was crying, and she was just thanking me for being there for her. But it's 20 something years later, and she still feels that pain. So definitely for people who are going through it right now, knowing that they have that support is very important.
Yeah, and that's a good point you bring up, that when we have these miscarriages or other challenges with fertility, it is a sense of loss there, and you do have to go through that process of grieving the loss and sharing, how you feel with someone, whether it's a support group or individual or couples therapy, discussing this challenge. And we know sometimes when these problems arise, it can really stress a couple out, and things get really tense. And so you definitely need a support system then, because you just want to make sure you get through what you're going through. And I think another thing we can do to support persons, this is something that I think we do in just as a cultural thing, that when persons get married or they've been together for a while, we'll say, oh, when are you starting your family? When are you starting your family? And we don't realize the kind of pressure that puts on people, especially if they are having challenges with their reproductive health and things aren't going according to the way they had hoped they would. And so I think as a community, not that you can't ask people what their plans are, but don't assume, and don't continue to ask people because they may not know how to answer it, and it may bring up some hurt feelings for them, not that you did it intentionally, but because they've been trying or they want this so much, but it's not working out for them. So that's one thing I would suggest to just the general public. If people are together, you know, um, just ask them how they're doing. We don't know the story behind why they don't have children yet or any of that. So I don't, any other advice for that? I think that's the
Yeah,
best thing I can give for that.
that particular situation of you just don't know their circumstance and what they've been through. And fertility treatments are hard. Women go through a lot of surgeries and procedures and medicines and injections and money and
Yeah.
time, and it's still not guaranteed that they're going to end up with a baby. So it's a stressful time. It's stressful on their relationship, and that's really good advice.
Yeah. Yeah. And then, you hear people say, well, they could adopt, they could do this, you know, just let them bring up what they want to do and then support them on their journey, whatever it may be. And it's just, again, things that we don't talk about because it's just not something we might share with friends. But this is something that is worth talking about. And we do know we see notable celebrities of all ages having healthy children, but we don't know what they've gone through to get to that point. And again, the expense behind it, which is unfortunate as well, that it's so costly to do something that you want so much. And uh, so that's a part people don't realize either, that even though these processes are out here that you could do, they are expensive and may be cost prohibitive for the average couple. Now, do you know, is there any kind of support for that? Like from medical insurance doesn't cover that. Is that correct?
It depends. Everybody has a different type of insurance. And
Hmm.
a lot of them, unfortunately, in this country, when it comes to women's health issues, the coverage isn't so great. But
Hmm.
there are a lot of insurances that do cover if you have what we call primary infertility, meaning you've never had a baby before. If you got your tubes tied and then you want to go through in vitro fertilization, they're not going to pay for that. But if you've never had any children and you haven't been able to become pregnant, there are some commercial insurances that will pay for it. And some of the bigger companies
Hmm.
usually type of income sensitive payment plan, or they do their treatments according to your income to try
Okay.
to allow more people to be able to be included in the process. So,
Hmm.
I mean, they make enough money that they can also do some charity and be giving as well. So don't let the money necessarily completely stop you in your tracks, because there may
Hmm.
be able to get it. And I also recommend to some of my patients that if your insurance doesn't cover it, you can purchase your own insurance. You usually have like a waiting period. It could be
Hmm.
a two before those benefits kick in, but it
Hmm.
would be cheaper sometimes to purchase and pay for a monthly insurance that will cover it for you, as opposed to pay the amount of money that it will cost you to go through the infertility process with no insurance coverage.
Now, this just came to my mind thinking about this. What about getting your eggs frozen? I know some people are doing that or considering that. Is that something, you should do if you think you might have a fertility issue down the road?
Definitely. It used to just be for the celebrities, and they
Mhm.
refer it to people who may have a fertility problem if they were going to have some type of cancer treatment, and they would be
Mhm.
worried about whether or not their ovaries, their eggs were going to survive, that they may do the freezing of the eggs. But now it's available to anyone. Particularly,
Mhm.
I recommend it if my patients are getting into their 30s and they're not considering a baby anytime soon. I do bring it up to them that they may want to consider getting their eggs frozen, because that buys them more time in terms of, remember, I spoke about miscarriages being most commonly associated with chromosomal problems. And
Mhm.
at age, those risk of the chromosomal problems increase.
Yeah.
And so we want to deal with our younger eggs. And you still can be they do the IVF with your egg, but it's just that it's an egg from 10 years ago, not your 42-year-old egg. Your 32-year-old egg will have a much better chance of achieving a pregnancy. If you're somebody that's going to have a baby in a couple years, then no, it wouldn't make sense to spend that extra money to do the egg freezing, but it is available to everybody.
Okay. Yeah. Thanks. Yeah. Look, we got that one in, but no one asked that. But I know that's something that people I hear, around that. Hey, that's what I'm gonna do because I don't know when I'll be ready, to have a child, but I
Yeah.
want the eggs to be my eggs and not, going to an egg bank and those kinds of things.
And
So.
I do encourage that if that's something that you really want, if you know you definitely want a child, but you don't have a mate, that you move towards considering that option, because it's also time sensitive. Most of the fertility organizations won't freeze your eggs after 41. They'll go through maybe individual cases and maybe take it up a little higher, but that pretty much is where the cutoff is age 41, because the quality of the eggs goes down and the chances of you having a pregnancy go down, and they feel like they're just taking your money, so they don't want to sell you fool's gold. So there is a timeline on it.
Okay, great. Yep, we definitely needed to know that. And I thank everybody and Dr. Carmen for her wisdom. Any last tips you have before we close out?
Oh, me.
Yes, you, sorry.
um, One of the things I would say is just your overall health, taking care of your overall health. Again, your mind, your body, and your spirit. And so that means surrounding yourself with good people, people who lift you up. I remember our bishop giving a sermon about the type of people that you hang around. If you want to see yourself in a certain mind space, then you're going to hang around with the positive people. You don't want to hang around with people that are going to be bringing you down all the time. And you want to take care of your health. So we really, as a Black community, have to do a better job of being better stewards of our health. Just because we see these fast food restaurants on every corner doesn't mean we have to stop and participate. We also have food. I can't even think. My brain is gone bad. The food markets, the fresh food markets that are out
Yeah,
there, farmers markets. There we go.
farmers market.
Markets as well, where we can have fresh fruit, fresh vegetables, cook our food at home, stay away from the salt, do our exercise 30 minutes a day. Just walking does wonders for the body. And all of that stuff affects your fertility. You being healthy, you being a more balanced weight, those are all things that will help you in the long run. So that's my last and final statement, is that we've got
Yeah.
to be stewards of our health.
Yes, that's good. Some good stewardship. Stewardship of mind, body, and spirit is important. And if you need help with stewarding your mind, you can call the Renaissance Center at 410-409-0025 and check out our website. And we are happy that Dr. Carmen came and gave us some information about women's reproductive health. We will be back again next month for Mental Health Awareness Month. So we're going to have some great topics for next month as well. and just share this information with family or friends that may need it, that may be struggling or with a reproductive health issue and concern, and be a support system to them. Most of all, keep them in prayer, and also make sure they get their regular checkups. No matter what's going on, we all need to keep up with our checkups now more than ever. So thank you, Dr. Carmen. Thanks everyone for tuning in. And if you have any more questions, you can always contact us at the Renaissance Center, 410-409-0025.